One evening, I was on call. Instead of going home after my 8-hour shift, I decided to stay at the hospital. Just after 7, a nurse called me to the OB-GYN floor because a young mother had miscarried her first child. When I came into the room, both her doctor and nurse were attending to her. She was visibly upset and quietly crying. I went around to the opposite side of the bed and introduced myself. I told her I was very sorry for her loss. Her doctor was also consoling her. She continued to cry, remaining silent, but I could tell she wanted to talk. However, she seemed to be lost in her thoughts. Finally, she looked up at me, breaking her silence, saying I must have done something wrong to cause me to lose my baby. She went on to say I was working long hours at the office. Maybe the stress was too much on my body. She was distraught about what she might have done or failed to do to bring about the loss. She shared that she and her husband had been yearning for a child. They were thrilled when she became pregnant because they wanted to start a family. Having a child was something they both dreamed about, and now after only 2 months, she miscarried. Like most mothers who've miscarried, she was in shock and disbelief. She asked the same questions over and over again about why this happened and that it must be her fault. She needed emotional support as she expressed her hurt and pain. Also, she needed the freedom to cry and to ask questions. Before I left the room that evening, I prayed with her. I let her know that the chaplains are available to help her and her husband to provide support that they need. I assured her that she was not alone. If you've lost a baby due to miscarriage, being stillborn, or early infant death, most hospitals offer a total program of support that addresses all of your needs. A neonatal death affects the entire family, the parents, the siblings, the grandparents, dear friends, and all need care and education about the grief process, as well as coping with their sadness over the loss of the baby. Here are a few helpful tips as you process your grief over your precious baby. Be patient with yourself. As a bereaved parent, healing from this loss takes time. Your love for this child needs to be expressed, and the memory of your child is important. Don't be afraid to seek professional help if you find that you've stalled in the process of grieving. Most hospitals, churches, and even funeral homes offer grief share programs that address your situation. Finally, please don't blame yourself for the death of your baby. One OB doctor stated that the percentage of miscarriages may be as high as 1 in 4 in pregnancies. I hope this video has been helpful to you, especially if you're grieving. And until next time, please take care.